Health Minister Dr. Aaron Motsoaledi yesterday visited some health institutions in the Northwest where he assessed the state of public health in the province. This after the ongoing National Health, Education and Allied Workers Union strike that has badly affected the healthcare provision in that area. 3 patients have died at the hospital last Wednesday night during the violent community protests which were calling for the removal of Premier Supra Mahumapelo. The minister now joins us on the line live from Cape Town. Minister, a very, very good morning to you. We had Section 27 in studio yesterday who were basically saying the situation is dire and 95% of the hospitals and the clinics in the province have no medication, not even a single Panado. What have you found upon your visit in that area?
Morning, Palisa, and morning to the listeners. No, yes, Palisa, the situation was like that, not because there are no medicines, because the depot was closed down. The strike has affected the depot. They were not allowing medicines to get out of the depot. There's only one depot that supplies all the 22 hospitals and about 400 clinics in the Northwest province. They get their medicines from one depot, and it was closed down because of the strike. And so we told the pharmaceutical companies to go and supply at the health facilities themselves rather than at the depot. That's when some of the health facilities started closing down, like the clinics. So, yeah, because over the weekend we sent the South African military health services from the Defense Force, the depot was secured. It was found that the private security company rather, that is guarding the depot was also part of the disruption. So that security company has been sent packing, and the army has now secured the depot. And as I left yesterday, medicines were now being delivered to all over. So the shortage of medicine was not because the government, the depot doesn't have medicine, but it's because it was sealed down.
Right. And Minister, surely the deployment of the army in that province is just a temporary measure. Ordinary people, patients are suffering the most. This is, of course, due to the grievances that the workers have. Are you able to intervene in that level?
Well, of course, sending the army is a temporary measure. It can't be forever. It's always temporary. Even in 2010, you remember during the national strike, we did send the army while negotiations are going on. We will definitely meet the union and the province and try to negotiate. But my going there, Palisa, was because regardless of what grievance people have, we do not think they must punish ordinary people, especially the poor and the sick who are going to look for health services, because they are not guilty in any way in whatever is happening in Northwest. They are actually victims, and they can't be victimized twice, you know.
And we do know, of course, that turning patients away from medical facilities, Minister, is a violation of the Constitution. Do you perhaps not foresee some problems of unnecessary lawsuits going forward? We've just come out of the Life Esidimeni tragedy. Surely you wouldn't want to go the same route again?
Well, Palisa, health workers are not on strike. There's no doctor or no nurse who's on strike as far as I'm concerned from the areas I visited. But they get turned away, they get intimidated. Like, for instance, the biggest health center, community health center in Mahiki, which is in Unit 9. When I went there yesterday, after visiting Mahiki Hospital, I found nobody there. But the senior people in the district told me that the nurses do come every day in the morning. They see the chronic patients and run away. This is a clinic that sees about 7,000 people per month. But yesterday they saw only 30 people and went away. So when I ask why only 30 patients are coming, they say, the nurses say they fooled some of the patients because these are chronic patients, they know them. And the patient themselves said, no, we've been warned not to come to the clinic because we'll be in trouble. Now the problem, Palisa, is that nobody takes responsibility for this. There's no union which came forward and say, I'm the one who's closing clinics. I met the national leadership of NEHAU And they said, no, we are on strike, we have got demands, but we are not closing down any health facilities. Not us who are doing this closing of health facilities, not us who have cordoned off the depot. So that's the problem we're having.
All right, Minister, time constraints. We have to leave it at that, but thank you so much for coming through.
Thank you very much.
Thank you so much to the Health Minister, Dr. Aaron Motsoaledi, of course, updating us on the situation in the Northwest Province, of course, as we've been reporting that about 3 patients have died ever since the strike of NEHAW members started in that particular province. The Minister saying the deployment of the army in that province will help in a way temporarily so to better the situation. All right, 7 o'clock, it's time.